Here we go. Hello everyone, Dr. Rich Castellano here, Wall Street Journal best-selling author of The Smile Prescription, award-winning double board certified facial plastic and reconstructive surgeon, here with another award-winning facial plastic and reconstructive surgeon, Dr. Chernoff, one of my mentors who helped me when I was going through my training. What an honor to be here and see you and be with you, and thank you so much for doing the interview.
You are a very humble man. You are an excellent surgeon, and I'm so proud to be sitting here with you.
Thank you. It really is very wonderful. So I finished my training back in 2005, just a few years ago, and time flies just like that. But we're here at the Aesthetic Show with so many different experts and people from many different fields, and amazing. I don't have the words for it.
You know, we're so blessed to do what we do. I think you and I are in one of the most exciting fields that anyone could be in, because every day we get to first listen to people to see what they're wanting to achieve, and we can offer them so many solutions to help them feel their best and look their best as well. So we're very blessed.
Yeah, we certainly are, and I can't keep up with it myself, but that's why it's great to be here and share ideas and do the best we can to share here. So thank you for watching. So you've had a lot of success in your practice and in your career. Where do you feel your greatest challenge is now? You've taught students, you've been a part of the teaching institution, you're cutting edge. I'm always seeing you're doing the symposiums and doing the lectures. Where is your greatest challenge now in what you're doing?
I think on a daily basis, our greatest challenge is in managing patient expectations. With more and more non-surgical therapies being offered, we're seeing people, I think the human nature component in us wants the quick fix. But I'm seeing patients choose the non-surgical therapies, but expect the surgical results. And particularly then when we see practices that aren't offering the surgery, they're taking every square peg and trying to pound it into every round hole. So I think that's always a daily word of caution for patients to be realistic with what they're wanting to achieve, and to listen to their doctor, because if the doctor says you're not a good candidate for something non-surgical, that's not bad news. It just means that the doc is being honest with you.
Yeah, well, it's very well said. And you know, as surgeons, we're trained as surgeons, and then you get into your practice and you're like, what? Nobody wants surgery? What? Wait a minute. And so now, as an advocate for our patients, we're like, what can we do to surgery for you? Let's try and prevent the surgery as much as we can. If you want more of a result, we need to have the conversation about surgery, but what are you really looking for? So you're right, setting that expectation. Surgery does a great job. There's always going to be a role for it, but now there's more of a role for non-surgical. So how can we blend that and meet your expectations and meet what you're looking for?
And we're also seeing younger patients coming in for treatments earlier.
Yes, patients are getting younger, they're living longer, and you know, so the field keeps growing. And the truth is people do treat us differently based on how young or how old they think we are. And of course, I love to say, none of our treatments really look as good as Mother Nature's free facelift when we smile.
No, and your smile analogies are spot on, and your book is so appreciated. So thank you so much.
Well, you know the power of smiling. Dr. Chernoff is a great smiler, and that is the greatest gift we can give to other people, is the gift of ourselves. He's saying, I appreciate you so much, and just to share that. And people don't do it that much.
They don't do it enough. I think we all live in too much of a me scenario, and we don't realize what a small gift, just a small act of kindness can be to someone. That's far underestimated.
Very well said. So one question I like to ask as well, so someone who's never been to the Aesthetic Show, how would you describe it? What would you say this show is about, and what has it been? What do you really like about the Aesthetic Show, different than the other shows?
You and I both go to a lot of meetings every year where the scientific value is very high. I think what Michael Moretti has done, along with Dr. Orton, is to really bring a beautiful mix of science and camaraderie that we don't see at some of the other meetings. There's still a lot of elbows in the air from some of the different subspecialties. So this has really been an excellent meeting to bring together some of the mainstream doctors and the non-mainstream cosmetic doctors as well.
Wonderful. This truly is a highlight from my career, because I can remember the days going into your office and just sitting there watching and figuring things out and be like, boy, Edward, how did he do that? And so thank you so much for what you've invested in me and in my education. I know how many other surgeons and students, and now we're here together and we're in our practices, and we're still students.
Every day.
Every day. So before we finish up the video, we always have to do our ceremonial selfie.
Wonderful.
We've got to make sure we have good selfie technique, and of course good lighting here. So we'll get good lighting here and take a big selfie. Cheese. Awesome. Dr. Chernoff, thank you so much for doing
Thank
the
you
interview.
for all you do.
Yes, my pleasure, and we're in this together,
Yes.
and the best is yet to come. So thank you everyone for watching, and we'll see you soon.
Take
Thank
care.
you guys. And oh, one last thing. What's your best website? Where can people find you?
So you can come and visit drchernoff.com.
drchernoff.com, Indianapolis,
And Santa Rosa, California.
and Santa Rosa, California. Amazing. I don't know how he does it, but he is an amazing man. So go look him up. Thank you so much, Dr. Chernoff.
Thank you.
Thank you all. Thank you all for joining in. Thank you.